The panel is around title Campus Cares, and we have such an excellent lineup of speakers and moderators. Very often, college days are called the best days of our life, yet occasionally, as we've seen and as we sometimes know from our own experiences, the stresses and the isolation of campus life can lead to adverse outcomes for students, and unfortunately, sometimes in the most extreme of ways. The purpose of this conversation is to explore how educational institutions can better bridge the gap between on-campus mental health support and external psychiatric services, as well as touching upon resilience-building practices that can be embedded in institutions. We have Dr. Arvinder Singh from Ashoka University and Ashoka Center of Wellbeing, who's moderating the conversation. And speakers, we have Mrs. Manisha Dhawan from the IKEM Foundation and the Convergence Foundation. We have Mr. Reddy Subramaniam, who's the former Secretary of Higher Education and Social Justice, Government of India. Dr. Ajit Bhide, who's a psychiatrist and psychotherapist. And of course, Professor L.S. Shashidhar, the Director of the National Center for Biological Studies.
We at IKEM are delighted to be part of this vibrant festival today. My journey with philanthropy started with Ashoka University and Central Square Foundation. We started the Convergence Foundation a few years back to work on economic growth and with a systemic lens. At TCF, we look at a variety of sectors from education to gender, effective governance in states, and accelerating philanthropy. I realized through this journey my passion for mental health and decided to start IKEM Foundation to work on projects I care about deeply. Mental health, rather well-being, is a cross-sectoral theme, cutting through every area we work in. Mental well-being is relevant as long as we are human. I cannot emphasize enough the deep connection between body and mind. Research, of course, also supports this idea. Through IKEM, we want to focus on the mental well-being of 11 to 25 years age group in schools and in higher ed. We are looking at a collaborative approach, pulling in different stakeholders from policymakers, subject matter experts, and service providers. The idea is to create advocacy and dialogue to drive systemic change. Of course, we are just about starting and looking forward to learning from our esteemed panelists today. And with that, I would like to hand it to Dr. Arvinder Singh, who heads the Ashoka Center for Wellbeing at Ashoka University, to start today's conversation. Thank you.
Thank you very much, Manisha, for those kind words. And a very warm welcome to all of you to Campus Cares. There are many stories that we carry in our lives, and there are stories that carry us. And our journey with our emotions and psychological well-being is one of those stories. It's just probably just one of those small stories on the side. I'm just reminded of the story as I was listening to Manisha talking about her journey. This story is based in 1935. No, I wasn't born then, just to let you know. But yeah, it was in 1935 when a newly appointed priest, Chadwara, was invited to perform the last rites of a 14-year-old girl. He was very curious on what had happened to such a young life, and he was devastated to find that this girl had taken her life. She had committed suicide. She had died by suicide. Sorry, beg your pardon for that, but yeah, we'll learn the language. She had died by suicide, and on finding out what could have led for this 14-year-old to actually take her life was the fact that she had just started her menstrual period and had nobody to talk to, was too scared to ask anyone on what that would mean, and she thought she had contracted some kind of a dreadful disease, a sexually transmitted disease, and that she was going to die a slow, painful death. So she decided to shorten that and take her life. This moved Chadwara, who was not only a priest but also a social activist, and he decided that he was going to open up spaces for people to come and talk about whatever was troubling them. And very soon, in the church, in a corner, he found a room. He put a little ad, had people talk about anyone who's feeling lonely, who's feeling like they don't have anyone to talk to, can come and talk to them. And very soon he found that there were loads and loads of people who wanted to speak with him. And he couldn't really cope up with people waiting and him talking, so he had some volunteers who just would, keep the people who were waiting a little amused, a little engaged. And soon enough, he found that the number of people who actually came out and were waiting were far more, and the ones who came in to see him were far less. And he wondered why people just left. Was it the wait that was too long, or what was it? And the volunteer said, no, well, they just had a little chat with us. They shared their story. They had a cup of tea. And they said, we don't need to see Chad. And they left. And that started the movement called the Samaritans, which many of you would be familiar with. Samaritans just is focused on the concept that people should have someone to talk to. There should be, any time that you're feeling lonely, anxious, sad, confused, lost, there should be somebody who you can talk to. And we all know that the silent pandemic of loneliness and anxiety that is actually taking many more lives, or even actually shortening the lifespans of people. So I'm sure that in this audience, each one of us at some point have felt anxious, sad, confused, lost, maybe worthless, felt probably that they don't really belong where they are, that they're not worthy of it, the classic imposter syndrome. And all of this and much more happens when we move from school to university. Much more and much more exaggerated feelings happen of confusion, of excitement, of the sense of freedom, and also the trepidation that comes with it. And if you happen to come to a residential campus like Ashoka, or to any other institutions like IIT, which are fairly, mostly residential campuses, all of this becomes even more, a lot more exaggerated, a lot more palpable. So the students, young students, feel a lot more vulnerable because they are away from home. And if you're in a university like Ashoka, which is liberal arts, it's a very new way of thinking, of being, of learning, and that adds to the kind of sense of anxiety that you may be having. Add to it the fact that you're in a different city, you're in a different country perhaps, you're doing different courses that you don't know, you've only heard of. You're very aspirational, and you may have been a topper in your school, but you are just one of the 800 toppers in the batch, or probably even more. What happens then? What about when you are a socially awkward or a socially anxious person and you find it very hard to connect with people? What about when you have to make those group presentations? What about when you come from a background which is vastly different from the university that you have landed in? All this and many more has added to the problems of mental health concerns that students face, especially in the higher education spaces. And, really looking at higher education, has it become, is it transformational, really? Or has it become like a transaction of grades, of placements, of really what kind of salary did you start with? What's your package? What is the return on investment? What about all those years that you have put in? So there is so much that comes with it, that education, higher education, sometimes becomes something which may not necessarily have the purpose integrated into it. Purpose, a sense of purpose, which is the key ingredient of well-being. So many questions, and yet as many answers as well. So before I get carried away and take up all the time as I see the clock ticking, let me invite Dr. Ajit Bhide to really set the context. Ajit insists that I call him Ajit, so I'm going to call him Ajit. So Ajit brings a very interesting lens of being a psychiatrist, a medical practitioner, as well as a psychotherapist. Very, very, I like to say it as a very rare combination. He sort of insists it's not so rare now, but we'll decide that later. And Ajit also has an interesting theatre background, a whole human being with not just a lens of medical interventions, but really coming from the space of being human. So Ajit, over to you to set us the context of this whole business of mental health through the lens of illness, wellness, and everything in between. Just a little house rule. So we're going to have, since we have this excellent lineup of speakers, I know you may have questions, and I surely do hope you have a lot of sharing also that you really do, because the aim of this session is totally to be able to share, to care, and to come up with very creative solutions to this ever-growing problem or need, I must say, of more people that can, really help campuses, and not just totally dependent only on having more counselors, more therapists, because that's never the answer. Just a small house rule that if you could just keep your questions waiting till the end of all presentations, because for the simple reason that you may find your answers in the next presentation, and post that we look forward to hearing all your queries, your questions, your sharing, and learning, because together we'll probably come up with very collaborative solutions, and each one of us will take back one new technique to really use with all the young adolescents and adults that need the attention that we could very easily give them.
Thank you for starting with that story of the Samaritans. Arvinder, it was ironic that what happened with Shad Vara happened to us in St. John's Medical College, where I was a consultant for a brief while. And we had almost an identical case. A young lady who tried to take her life because she had her menarche in the first period, and she thought she had a terrible illness. But there was a background to it, because her aunt had died of cervical cancer, and the family had put all their resources into caring for her. And they were deeply in debt at that time. And she said, oh God, now I'm going to cost the family a lot. So the importance of basic physiological or sex education is so necessary, driven home to me by this point when I was a fairly young assistant professor in St. John's. So actually, the movement for having wellness centers on campuses has grown fairly impressively over the years, but it's largely in privileged institutions and universities that we find this. To have even a counselor available in high schools and colleges across the country is still a bit of a dream, and we need it much, much more. Also, these wellness centers are, I might sound a little sarcastic in saying this, but they are euphemisms for suicide prevention cells, because that is the major problem we grapple with: young people taking their lives even before they've reached the prime of their life. And we are geared towards that. But as you mentioned, Vivek Murthy, the Surgeon General of the USA, was here recently, and I felt very cheesed off because I thought I had coined a term which he had actually coined. That is the epidemic of loneliness. And loneliness is so rampant. It's a cliche now to say that you have 4,000 friends on Facebook, but not even one you can open up to. But that's the sad fact of today's life. And it's not fair to blame the young people for what goes wrong in their lives, for their resorting to desperate measures, because the times are such. Emil Durkheim, the German-sounding but French sociologist, came up with this notion of anomie. We live through anomie for more than 3/4 of a century in this country. No definite social norms. And push your way through life is the kind of thing that's occurring over here. That can be very traumatic for young people, much more than it is for grown adults and people who've been exposed to the battles of life, come out surviving, if not victorious. In our wellness center, I've had the experience of setting up the wellness center at the Indian Institute of Science, and there again it started because there were suicides on the campus. A young doctor who was the campus doctor initiated the process. Hardly anybody remembers that part of the story. But then they took it up in a big way, and they have a wellness center. And of course, you know the story about the school counselors. People creep up to the school counselor and say, I want to see you, but I don't want to be seen in your room just now. Can I see you privately somewhere? Because the stigma that attends on a mental health consultation is almost universal. We imagine it's Indian, it is not. It occurs even in the most advanced of countries. They don't want to be seen outside the shrink's office or in the waiting to see the shrink. So now we find that people not only with suicidal ideation, but even other problems of living, as Carl Rogers would have it, come to the wellness center, seek advice. Sometimes they just want to ventilate. Now, because we have this phenomenon of people not wanting to be seen by the shrink, or not wanting it to be known that they're seeing a shrink, the wellness center devised a very elaborate plan where we have specialists across the city available to them. And whatever the consultation is, the institute reimburses it. Up to a limit, of course. They will also reimburse any prescription medication that is given by these selected doctors, selected only because we need a widespread coverage. I'm about to get involved with the National Law School of India University in a similar venture, because they've also faced this problem of loneliness and people who take resort to desperate measures. Now, most of these young people we deal with are people who are now legally adults. We want to take the help of the family to bring in or restore some kind of balance in the family. And the young legally adult person says, hey, don't reach out to my family. My family will never understand me. I don't want my family to be desperate. I don't want my family to be distressed by what I am going through, so don't involve them. For a variety of reasons, they don't want us to reach, and that puts us in a real quandary. But we've taken a firm decision. When there is suicidal ideation, we will reach out to the family, and we will deal with whatever problems the young person has with the family at a different level to see that that does not aggravate an already bad problem. So that's the story of the wellness centers that accrue across the country, and especially the ones that I am particularly familiar with. A lot of young people have issues about not being understood. And we know there's been a revolution in our understanding of gender-oriented disorders, and gender identity becomes an issue. Young people have resorted to desperate measures, mainly because they find themselves misunderstood or not understood at all. And we've taken adequate measures to see that we cater to their needs, which are special, and which professionals are usually sufficiently geared up to look after. So that's where we are. I think I'll stop over here and leave it for my other experts on the panel to take up the issues.
Thank you, Dr. Bhide, for really setting the context of how it is actually something that we all need to really look at. And I was fascinated by the story that it actually happened in the Indian context, pretty similar, which means the issues are so universal. I'd like to also sort of say that in the context of higher education, we're really all aspiring for higher education to be, a transition and a transformative experience, and go beyond the transaction of credits and grades and so on. And of course, we look to policies and what kind of measures, or are there any studies that really indicate that there has been some shift in the needle, or actually we almost always have a kind of a bias towards, has the government done something about it? So I would actually now move to our next speaker, Mr. Subramaniam. But yeah, why not Professor Subramaniam? I mean, you're in that. Absolutely. So you just got probably an additional title, and so Mr. Subramaniam, for you to really take us forward and talk to us about your role with the NEP 2020, the micro study in 2015, and really heading the higher education and the social justice sector. What was your experience? What inspired you to really take those measures, and so on?
Friends, it's great to be here among such learned people on the dais and off the dais. I'm sure each one of you who are sitting here are fairly erudite know a lot about this particular sector. So it makes my task very easy in some ways and very difficult in some other ways. Easy because you don't need to say much because they know a lot, and difficulty is to find what to say. So, so I just move out of the so much of scientific knowledge is already present here. So I just wanted to tell you where we stumbled upon this problem and what we have tried to do when I was Education Secretary in Government of India. So friends, we all know that in higher education system, there has been less than optimum outcomes, academic outcomes that were being produced, even in the most premier institutions like IITs. Other institutions, the situation is a lot more serious. So when we are just trying to understand where to start, because I know it's a complex factor, why academic outcomes don't come as you expect. So one very disturbing thing that we found, and that happened in the most elite institutions like IITs. So we found that at least 25% of the students who are studying in the IITs across are actually performing below par. Below par because they have come through a fairly competitive examination. Of course, I'm just keeping aside this entire controversy about all this coaching and all that. So that also actually adds to the mental tension. But the people who have entered the institution with fairly high academic accomplishments, we find that at least 25% of them are underperforming much below the expectations of the institution. So we started by saying that it's because everybody comes through these coaching factories and all that, they don't understand the concepts. So IITs drill on concepts, your understanding, application of knowledge, and then take you to the next higher level. So they are not trained in that particular thing. So there is a crisis, academic crisis. But when we drill deep, we just look deeper, we found that large number of people are depressed. It's not small number. So this epidemic sort of a word resonates when we started looking at these campuses. So, and then we were hit by a wave of suicides, and then of course suicide in IIT is a sure question in Parliament and also headlines all over. So it really sort of brought a spotlight on the ministry, as Professor is mentioning, as to what government is doing, what can you do. So, like in many cases, we were rather clueless. So we fell back on one professor, a very reputed man. Many of you know him. He is called the father of artificial intelligence in India, Professor Pratim Chakrabarti. So he was the director of IIT Kharagpur, which is the biggest of the IITs in terms of the numbers. So what we said is that now come up with some sort of a study, a micro study you conduct among your students to see what is actually causing this anxiety and depression, which in some cases is driving to suicides. So what I wanted to present is what we have done in 2017. This study has been, micro study has been done. It has it has not been published because see, the publication requires certain more academic rigor. We don't have it. But what we understand is that where the problem lies and where the solutions lie. So, okay. So I just want to take you through this very briefly. So first thing we are saying is that I'm not talking about the entire higher education sector. We don't have that sort of data. But we have some data about the premier institutions. Of course, the problems in the premier institutions will be very different from the other institutions. But right now, I'm limiting my observations to these premier institutions. At least 25% of them are actually having issues, and that is actually resulting in poor academic outcomes and their performance. And in some extreme cases, it also leads to suicides. So, of course, this NIMHANS has done the great survey of the National Mental Health Survey 2015. All of you would have read it, and some of you would have participated in it in an active way. So, they have tried to put across what are the reasons which is causing mental stress and also anxiety and poor well-being. So, I'm not going to go into it because I'm assuming that all of you would have read that very path-breaking study. I'm so sorry that it has probably the next study has not come through after 2015, but I hope something will come through. So I'll just straight away go into what we found in this micro study. We found that primarily the issues which are reflected in a very frank collection of responses from the students of IIT Kharagpur found that there are 4 different types of issues which students are facing. One, of course, is academic. Academic stress in the premier campuses is, of course, very high because there is a lot of expectation, and in our system, what happens is that there is always a dissatisfaction for 2 reasons. One, you like a particular subject, but you don't get it because your subject is allocated by the ranks, not by your interest. This is a big problem in our system. So whoever gets the highest rank will get it, whether he will take computer science. Whether he likes computer science or mechanical engineering or social studies, he takes only that. So most of the students we found are unhappy in the class because he wanted computer science, but he is sitting in civil engineering. And somebody is interested in mechanical engineering, but he has got only chemical engineering based on his rank. So there is a lot of stress, pre-given stress in the academic aspects of the students, and so we found that the entire the JEE legacy of cramming things is actually impacting the way that the academic progress is there, and that's causing a lot of stress. Second thing is, of course, aspirational. They all feel that IIT means end of the world. I mean, that means he has come to save the world. So that is the sort of expectation of the society, of the parents. Expectation of the students are too high. And family is actually is partly responsible for driving this aspirational anxiety. So they all want highest paying jobs. He has got 1 crore package. How come you got only 30 lakhs? Is a very constant nagging that family makes, and that actually increases a lot of stress. So what will be my package at the end of this is something which actually distresses large number of students. On the social aspect, we find that relationships, the peers, the language, we found that a large percentage of students who come through from the rural areas without English speaking backgrounds, they get badly treated. So socially, there is a lot of stress if you actually come from a rural area or from a reservation category, unfortunately. So they face a lot more challenges socially. Then, of course, the lifestyle. There is a lot of change of lifestyle from where they are coming from. So lifestyle challenges are actually also found very important aspects. So the students who have responded, most of them have responded that they have some anxiety or the other based on these 4 categories of the reasons. But many of them manage. They manage because that's how there is a support system which IIT gives, etc. There is a community, friends. So, but then there are some people who actually fall behind. So what we have asked the students as to tell me what is actually stressing you. I can see that you are in stress. What is stressing you? A large number of people have stated examinations. as a big stressful thing. The grades that they get and the time management that they have to do is actually leading to a lot of stress. And contrary to what we really felt at that time, that a large part of the stress is because of the social thing, but we found that a lot of stress is actually coming from the academic, the way that we transact academics in the institution. So, I mean, why I am stating these 2-3 questions is that the answers from this should lead us to right solutions. See, we all know that this is a problem. All of you know so much better than the policy makers and people in the government. But we are interested in finding solutions. So finally, okay, fine, you have a problem on hand. What do you do with it? The second question we asked is, what makes you happy? The question, the answers are very startling. So everybody said, I mean, virtually everybody said, it is the friends who make them happy. See, the implication from this answer is very clear. The solution actually lies in building up peer relationships, and this is a very interesting thing. There are other things. I am not stating everything. What stands out very clearly is the importance of having proper peer relationships. So we also asked what relaxes you if you get into a stressful situation. We're running. Okay. So what relaxes you? So again, it's the friends and the music and the games. So why I am stating these 3 things are, again, these are the pointers to where we can actually look at it. So finally, when we have done this analysis, we found that everybody is having some sort of a stress or the other. I mean, there is no exception. But they are actually in the, if you put them in the scale, there are many cases where you can actually do by self-help. Okay, so you just bring out standard operating manuals for time management, for looking at academic betterment, and then you go through it, have orientation programs, focus group discussions. As you keep going, so we come to the second phase where you require counseling. So you require clinical psychologists, and then if that doesn't work, then we have to go to the psychiatrist and also post-vention special group. So in this continuum between apprehension and the anxiety resulting in suicides, we find that at every stage there is a solution. We just got to get that in. And so I will basically wanted to state that after this study has been done, what we really looked at is, you cannot look at mental health as a separate issue. I mean, you have to look at mental health as an entire attempt at well-being. How do you promote health promoting institutions? How do you bring health into the entire policy making, definitely, and also in the way that the institution designs its own academic programs and also the core curriculum. So that actually resonates in the NEP 2020, which says that well-being, mental well-being is an important part, and it should be integrated with the academic, the way that you deliver your academic system. So I'm not going into the other things. There are many new factors which are coming in. Some of the factors which I see, in IIT Bombay, there is a big fight about veg and non-veg mess. I mean, it's a simple issue. Just I think 10-20 of them, they had an objection, and it became a big problem. So there are newer item issues which are coming. So I wanted to state that I have projected this 9 possible measures which we can take. I'll be very happy if there is a discussion on possible ways to take it forward. We can discuss some of them if there is interest. But I can say with confidence that this problem needs an immediate solution, and solutions are available. We have to just find ways to adopt it. That's all I will say. I know I ran out of the time. Thank you.
Thank you very much for all the information on the micro-study. I think it resonates with what we already have probably intuitively sensed. And at Ashoka, I can for sure say I completely agree that having more clinicians and more counselors is never the answer. Actually, if we really have to bring a shift in the narrative, it lies in creating community-based and community-led initiatives. So one such initiative at Ashoka University is the RA program that we have. RA is the acronym for Resident Advisors, and these are students who are, who take care, who are peer supporters, peer educators, and they really reach out. They're trained people, they're also the mental health first responders, and that's the flagship program of Ashoka University, the Gatekeeper Training, where we actually help students to, not just, it's largely for students, but also faculty and staff to spot people that may be at risk, and to identify resources, and to sort of listen to them, share with them, and connect them to the right resources. Because very often, for all the problems that were just listed, the answer sometimes is in providing that safe, emotionally safe space to sort of just share, to unburden yourself, de-stress yourself, maybe have a validation from another peer to say, it's normal, that happens, yes, I felt like that when I was junior, is enough sometimes to tide over. And for people that are socially anxious or awkward, just simple measures like if you're sitting at a table, and you find somebody sitting alone and eating, just pick your tray, sit on that table and eat is just enough. The point here is that any initiative can be done, and it cannot be driven, otherwise we are always going to lament about the gap between the number of professionals, mental health professionals available, and of course the need. I mean, in this room, I know I can safely say that all of us at some point have been on some sort of spectrum on anxiety and stress, and yet we've dealt with it. There are many, many, many those who can't deal, and then those that fall through the cracks. We need these collective approaches. We need just the compassion and care to really connect them. And while we understand the context and we see some of the measures, I think today the idea is also to really cull from our learning, from our experiments, from our small studies, to see what each one of us can actually take back. You may be somebody who is either in the higher education space, or you have somebody very close to you who's in the education space, or simply another human being that's really looking out, crying out for help. All they need is compassion and care. So let's just build these circles of care. And I would now like to invite Professor Shashidhara, who needs no introduction, the director of NCBS, has held, is a leader here, in NCBS, and yet has also worked with other universities, including Ashoka, as a faculty member. So he has this wealth of information and direct engaging with the student population. Let's hear from you on what you think are the measures that we could take. Thank you.
Thank you for organizing this very important session as part of Mannotsava. Yesterday at the inaugural, I was talking about the science of mind and how to understand this. The problem we all face in human societies is an advantage and disadvantage. The advantage that human societies have compared to all other animals is that we can talk to each other. When we talk to each other, we understand each other, and that's how the society can be built. Knowledge can be made cumulative, starting from pyramids to today's modern buildings. It's a continuous journey in terms of science and technology, or knowledge, just whether medical or otherwise. At the same time, knowledge or language also has given our ability to understand ourselves, right? What called third order theory of mind. And that language, because we assume that we know so much about ourselves, we don't respond in a way where other person has a different opinion, different attitudes, different experience, different backgrounds, and that's conflict leading to all kinds of conflicts in the context of, in today's discussion, is the way we start thinking about ourselves in the society. When we talk about higher education, we also think that higher education system is, starting from scratch, because school has done whatever it's supposed to do, and now the students have come to higher education. We need to sort of train them in higher skills that is required, for their career, for a profession, or for the society, whether becoming an engineer or a doctor or economic advisor or so forth. But what so happened that in the rapid expansion that we have had in high school and higher education, everywhere there is gap, right? School education also incomplete. So typically, school education in the initial days was about learning numerical skills and social skills, language skills, and later when you go to the high school, you learn what is somewhat known and connect the dots. For example, what is society means, what is governance means, what is the position of all life forms on Earth, what is the status of very different stars and galaxies and so forth. You connect the dots, and that's how you end up getting a wholesome education in the schools, and then come to higher education for specialization. But if the school education, there are lots of gaps, and when they come for specialization, they feel at loss, suddenly trying to learn something which is alien many times, whether in engineering, medicine, or even general sciences. I'll talk about with specific examples of, not Ashoka, because you are representing Ashoka, you have already explained very well. Particularly, I really like the concept of RA, and that's precisely what I'm going to mention also based on my experience. I was part of setting up Indian Institute of Science, Education and Research, the new sets of institutions that were set up in 2006-7 onwards, and called ISERs now. Like IITs for technical education, ISERs for science education, and ISERs were also set up by Act of Parliament. And because it's a central, education system, students come from all over the country. In fact, I realized later that what we tried to do in ISER Pune, where I was a founding member, we should do in every colleges these days, or in every university these days, because every small town in India is a microcosm of the whole country. Right? Gone are the days when you can say only Kannada speaking students will be there in one college, in a small town like Shimoga, for example. Even those places, now we have a multilingual, multi-socio-economic diversity represents in a higher education system. So students come from all backgrounds. People didn't know how to use, for example, a Western commode in the toilet, whether there's a common toilet system in the hostels. And that was making them very stressed. Or students didn't know how to, understand the different languages people speak in their own small groups, and then trying to sort of imagine all kinds of things. So invariably, students will have certain kind of stress, paranoia, which lead to all kinds of more complicated outcomes, lack of motivation, attention, not showing interest in studies and all those things. Many times it's all simply because they're not being able to adjust socially in the campus. Suicide and all those things are much more extreme cases. Many of them perhaps has certain medical background, but very often 50 to 70% of the problems are simple problems which are easily preventable if we understand them, right? So a series of events that we organize, one is to just science of mind itself, how to understand each other, right? Because we know so much about cognition and consciousness and how the brain functions and all, and how we perceive things using very different sensory organs, using very different, based on our past experience, how we interpret things. But we never really teach all of these things. Now, we say everybody should have basic education in languages, numerical skills, and social skills. But at the same time, we insisting that everybody should have some understanding of evolution, because that's what we are all about. At the same time, environmental studies, at least thanks to Supreme Court intervention, it is made compulsory now in every higher education institutions. Although it's more like a lip service that because it is compulsory, but it's not added to the grades, so students simply come and attend and write an examination. But it has to be much more, intensive. Similarly, similar to environmental education, understanding the mind should be something which should be common across all institutions, irrespective of what they study, whether they go to engineering or medicine or whatever. I think one course in the very first year itself, understanding the mind is important, because now we know so much about it. There are enough tools, all kinds of internet resources, authentic internet resources on understanding the mind, and this hopefully will reduce. That what we tried to do in ISER Pune was to introduce such kind of interventions. Second is more diverse engagement. and telling all our faculty that your classroom is very diverse. Don't assume that your students know this. Don't assume that your students know, this particular mathematics or this particular physics. Don't assume that they all understand your English. Don't assume that your PowerPoint presentation, when you make, everybody will be able to follow. And particularly if it is crowded, you show it for 1 minute, a large slide with full of text and equations. In 1 minute, they should be able to grasp. Don't assume all of these things. So we try to sort of intervene at very different levels. Most importantly, making students to know that it's, or make them to understand that it's okay to talk about your problems, right? And first thing we also, because in evolutionary biology we say every individual is different. It's natural to be different. It is actually unnatural to be very homogeneous. That's what evolution is all about. Diversity is the key for survival, and diversity is the key for what life has been on Earth for 3.75 billion years. And everybody is individual. In the family, everyone is individual. There are two reasons you are individual. One is because of the biological reason. Second is because of your past experience. Even monozygotic twins grow separately because their experiences are different, their opinions become different. Their body language becomes more and more different, unlike in Hindi movies. They are different, right? So it's very important to know that being different is okay, it is natural, and they can talk about it. So many students, they actually started open talk. We started weekly talks about their past experiences or their current experiences, and they openly started talking about, I had this depression problem, I had this lack of motivation problem, I had this, and they weren't talking openly about sexual orientation. We made them very comfortable to do that. And that actually helped a lot to reduce any kind of incidences of kind, particularly, unless of course they're medically has some problem, because in school days itself they had problem, and families knew about it. They explained to us that this student, my kid has this problem, please take care of them specifically, separately. And we followed that, of course. Many times, of course, parents wouldn't know. Parents may not want to tell us. Then we need to understand ourselves. But obviously privacy, confidentiality has to be maintained. And those who want to come out and they want to talk about is fine. As Ajit mentioned, the counselors, maintain certain kinds of privacy and meet them in confidence and maintain the confidentiality of the information they gather. All of these things helps in an organization. So last point, again to repeat, having a course on understanding the mind is very important. We know so much about it, but we are not telling the public how much we know about it, right? And the explosion of research on human brain with a variety of different techniques, we can actually see through the brain in a variety of different ways, and we can understand by interpreting the behavior. But earlier ways of interpreting the behavior, the Freudian way of, people have already debunked it. There are multiple different ways of understanding the behavior and the cause for different kinds of behavior, and that helps a lot. And the second is understanding the diversity and respecting the diversity in the classroom, diversity in the campus is very, very important. And I'll stop here in case there are some questions. Thank you very much.
Thank you so much for that. I think I completely resonate with the fact that understanding the mind is an essential in the academic setting, and diversity is the key for survival. Not just survival, I think diversity is the key for thriving on any campus, and I think all the campuses that have been there are a testimony. Very quickly, I'll just summarize the points that have come up today. One is the need and the importance of building the mental health literacy, and of course the focus on research so that very evidence-based interventions can be learned from. Capacity building, there is just no two way. I think yesterday's session, one of the sessions was about there is enough awareness, everybody talks, now what? I think awareness has to be linked with action. From awareness to action is, I think, a slogan that we should really stand by and go with. So capacity building at different levels. I think there are a lot of resources in this room. I for sure, on behalf of Ashoka University, can say that should any of your institutions need any kind of collaboration, any gatekeeper training, any shared practices, very happy to share. Because I think it's time we break the silos. It's time we actually really look at spaces which foster this culture of care. And I'm just going to end with a literally less than 2-minute video on that is a sharing by the students of Ashoka University. Actually, it focuses more on spot and support. So if you spot someone who's lonely, who's not talking, who's shy, who's anxious, just support, just talk to them and connect them with the resources. If we could quickly have the video and post that, we will open for your questions if you have any. If no questions, I would definitely like to hear what were your reflections from the session, any key takeaways from it, and so on. Thank you very much for all your very kind attention. And thank you, NCBS, NIMHANS, and of course, Rohini Nilekani Philanthropy. Thank you very much.
When I was a student, I used to think that RAs were people on the floor to discipline you, to make sure that you follow the rules and so on. But once I became an RA, I realized that this is a position to help people. I realized that RAs are there to help the students. And so I've had the chance to help students with all kinds of issues, physical issues, like logistical issues, and especially mental health issues.
Being an RA for me has been the most rewarding thing I think I've done on this campus at least. Like before, I didn't really have a space I could say I belonged to, but with this entire group of say RAs as a whole, or being responsible for an entire floor of people, it gave me a place to belong to. It gave me something that I could contribute to as a person and as a student. So yeah, it's been a journey.
This journey of being able to help people has been very transformative for me. And so I feel like more people should sort of apply for this role. I feel like being put in that position to go and help people is something that teaches you a lot. You learn how to be of use, which is something that I think we could all use. And I feel like you learn what it's like to be of support, and that's something that translates into your whole life, right? So I feel like it's been incredibly transformative. Coming into a residential setup combined with all the academic, social life, and just this stage of your life makes it very important that you address your mental health growth as well. I feel like that's something across the country people don't really acknowledge, and so the fact that RAs are there to sort of guide students through this journey and be there, especially when it's the hardest, I feel like that's transformative, and I found that I've had that effect on people, and that makes me very proud of myself.
Hi, my name is Anshika, and when I applied for RA, of course, did with the intention that I want to make students feel welcomed, but one of the biggest anxieties I had was that how do I exactly do that? And I think a lot of it comes from the ACWB session that we had right now, and it was amazing. And I think along with knowing what students, how to deal with the students, I think I also realized how to deal with myself. So it was really helpful. Thank you.
Just one point I forgot to mention, I thought Ajit would have mentioned, he's an artist himself. It's very important that we give opportunities to students or the community to express their thoughts through a variety of different forms. Not everybody is good in speaking and explaining things. Some maybe use painting, some maybe use music, some maybe using plays. I think it's important to have those activities in the campus so that all students will have an opportunity to express themselves. Once they express themselves, they feel very relieved. Once they're relieved, most of the stress is gone.
Hi. Before we take questions, we have very little time, so could we take 3 questions from the audience and have the panel address them, please?
Highly informative session. And in fact, I would like to talk about this mental health literacy which we have been talking about, and I am sure for the last about 10-15 years, NIMHANS has been doing such kind of things about implementing mental health literacy right from school education onwards. So why is that? Okay, there is a big gap. For so many years we have been talking in seminars, but no action has been done. That is one thing. Second important point is about the mental health education programs. If at all, if it is so important, why is that in the higher education sector we don't introduce one particular subject for at least for the first year in colleges? That is for you, sir. Thank you.
My question is one with reference to national education policy, because recently I have attended NIPA Nalsar Hyderabad, one of the professional development program, when they have oriented us regarding NEP 20. So what are the components for suicide prevention? Those is one. A small another thing, we have a lot of nominated representative kind of things also. We have elected student body system also, both I have seen in my educational career. So recently prominent national university also has some of the suicide, which has pressed some of the All India Institute to go and give lot of intervention. So why we are, lot of proactiveness is required. So what we can do collectively is my question.
I have one question actually. If we're talking about higher education, what does preventative and I think curative mental health look like in healthcare institutions, whether it's mental health or healthcare itself, as in physical health, doctors, nurses, because usually they come out burnt out, they come out isolated. So what does that look like? And in terms of diversity, I just wanted to mention that something we need to look at is also marginalization of, in terms of caste, gender, and disability, which is something we're talking about a lot more now. But what does that look like in, I think, practice?
I just wanted to address about what is it that we are actually doing. See, we feel that talking about a mental health directly to the students is not a great idea. We feel that one very good solution which has actually got developed and probably it's still taking shape is how do we talk about campuses which are having healthy students. So it is actually the balance between the body and the mind and then relationships. So that sort of a subject can actually come in. There is a very good course which has actually got designed. So it is going through a process. So we don't want to talk about mental health directly, but we look at the well-being as a whole. That's what NEP, you talked about NEP. NEP doesn't really talk about mental health. It does say about health and mental health, but it is basically talking about well-being of the student. So the wholesome development of the personality. So
I'll add perhaps what I say is relevant to all the three questions in a simple way. When you say mental health education, or you mentioned about why it's not being done, why it's being that way, it's being done always as a problem, right? But you don't talk about it in a very positive way. Yesterday I was mentioning, for example, even the word handicapped or disability should not be used these days, because that's a positive way of saying that differently abled, right? That's how it should be introduced. Mental health, most of the orientation or discussion happens when to talk to the people who have some problem. We don't talk about it. It's a society as a whole need to understand this. Even, for example, I may not have any specific problem that I can complain of, but if I understand better what are the mental health issues, how to understand this, I should be able to understand my neighbor, my classmate. Then I actually be more considerate to my classmate, how that person behaves, how person talks about certain, express certain views and kind of stuff. So that's why I'm saying that a course on mind is more important than mental health. Mental health, again, every time we talk about as a disease rather than simply a diversity of mind, right? Because diversity of mind, if it is respected, slowly it becomes normal, then you will not get into the disease mode. Because we try to suppress this as a health problem, and it sort of becomes larger and become a medical problem later.
Discrimination, and I think that's a huge issue even today, much less than it was 2 decades ago, but it's there. And we find this discrimination on the basis of socioeconomic background, particularly caste, interferes in the best of institutions from time to time. And I think we're working on it. There is no perfect solution. If you have any ideas, please share them with us. But we noticed, at IIC we used to have lectures for students and more lectures. And they said, what about the staff? They need to be educated. And we discovered that a lot of bullying was happening on campuses, especially PhD guides who were considerate to an extent, but some were totally not geared for it. We have a wellness center over there. We also have wellness coordinators in every department. And they are people who are geared to being, in a sense, therapeutic, in their good listening skills and so forth. So that has helped a lot to facilitate addressing people's grievances on the campus. And it's working out fairly well. But again, the stigma attends on it. There's just no running away from the reality of stigma.
I want to also say that, we also need to understand and remember that the responsibility lies here. If there is something, I would ask myself, what am I doing about it? Because it's no longer really the domain of the professionals or someone else to take care of something. And having said that, I do also acknowledge that it's a systemic issue, and so I keep that there, but also remind myself continuously that what can I do to make that little difference. On that note, thank you very much, everybody, and it was absolutely wonderful. Sorry, we overshot by 3 minutes.
I mean, the conversations are so fascinating, but I did want to offer that there is a speaker's lounge to the right of the main auditorium. If you all have some time, you can sit there, and people from the audience who want to continue this very rich discussion are welcome there. But also just to say thank you to all of you. This was such a wonderful discussion.